Yeah, good afternoon. This is Elliot Stone, your moderator. Joining me will be Linda Lotterman, a life care planner of 30 years. We'll be having a question and answer session at the end where you can just fill in the question box on the right side of the page with any of your questions. Now, let's begin with a very brief intro about life care plans for those not familiar with them, and later we'll go to medical cost projections for your smaller $50,000 to $200,000 value cases. Life care plans are utilized to maximize settlements in personal injury cases. Historically, they've been used mostly on catastrophic 7- and 8-figure cases due to the attendant cost. Most attorneys may have 0 to 2 of them per year on average. The life care planner fees run anywhere from usually $5,000 to $25,000 per case. Many of the life care planners charge by the hour, bringing uncertainty as to the final cost. They're generally used later in the litigation to preserve working capital, with the hope of bringing about a settlement with expense reimbursement. The much more numerous mid-range cases, your neck, back, requiring continual medical treatment with injections, PT, RFA, worth $200,000 and up, usually have not warranted life care plans until now, mostly due to cash flow concerns. Our basic premise is that more life care plans mean more larger settlements. And our interest-free plans on a lien payable at settlement we feel is a game changer that will dramatically increase firm usage and profits. Life care planning was brought about 30, almost 40 years ago by a fellow named Paul Deutsch. And it's proved valuable in managing catastrophic injury and illness. The methodology provides professionals with a consistent process for analyzing the immediate and lifelong needs of patients. So, what's in a life care plan? What does it provide? Well, it provides an organized, concise plan for current and future needs. It accounts for all of the medical care and rehabilitation needs of individuals with serious injuries. Life care planners are composed of board-certified professionals in rehab counseling, nursing, physiatrists, and case managers. There's a board certification in life care planning granted by the Commission on Healthcare Certification. The plans are based on the medical record review, client interviews, recommendations from members of the treating team, clinical-based guidelines, and evidence-based research relative to the individual's disability and level of function. The life care plan includes medications, diagnostic testing, wheelchair needs, projected future medical care, orthopedic equipment needs, projected surgical treatment, home furnishings, aids for independent function, and many other items. Now, here are 2 sample summary overviews of 2 plans. One's catastrophic on the left, one's non-catastrophic on the right. You can see on the left, the home care health services total about $1.4 million of the total. Clearly, that's a person that is not independent and needs, looks like around-the-clock care. On the right side of the page, you see a typical non-catastrophic life care plan valued at $260,000, where the home care is only $9,600, so clearly this person's quite independent. On this case, the adjusters probably initially offered, if anything, $25,000 to $50,000. Now, let's focus on the much more common mid-range cases valued at $200,000 and up. Most firms have anywhere from 5 to 20 of these type cases at any one time, many more than the much rarer catastrophic 7- and 8-figure cases. The non-catastrophic cases that warrant life care plans generally are a minimum of $200,000 case value. Plaintiff has some continuing medical issues, and the adjuster's offer, if any, is unacceptable. They may say the client's a malingerer. Don't tell me about your damages, show me. And the value of the lien-based life care plans really comes into play on these types of cases: motor vehicles, slip and fall, neck and back, cases involving pain injection, PT, possible future surgery. Now, here's a typical example of its value. This is a $250,000 commercial policy where the adjuster says, I'll pay you $25,000, get lost. Now, you go out and get a life care plan that values this at $400,000 as the one on the right does. It forces the adjuster's hand. They look at you in the case much differently, and now they're going to be raising the reserves due to the pressure. And they also have to start being concerned with bad faith claims if the jury awards, in this case, the medical costs of $400,000 with a $250,000 policy. So if a firm has 5, 10, 20, 50 of these type cases, and you're able to get an extra $50 to $100, $200,000 per case, it really can make a big impact on your bottom line. Now, here are 2 sample cases of actual clients. The one on the left involved a leg fracture, a herniated disc, and fractured tooth out of an MVA situation. Initial offer was for $7. He used the life care plan, and mediation got $200,000. The case on the right involved a typical catastrophic case where the client got $1.75 million, and the thing he liked the most is he didn't have to lay out the $15,000 plus to get the plan. He only had to worry about paying it back at the conclusion of the case. Now, here is a chart of 8 different cases, actual cases, and the results by utilizing life care plans. And I'm not going to go through all of this now, but all of you will be sent a copy of this webinar and this PowerPoint where you could look at some of these numbers, but it's really quite revealing. On the first case, there was policy limits of $250,000. It was an MVA case. The plan came in at $464,000. That was the defense offer was $35,000. The $463,000 was based on the plan, and the case wound up settling 7 months post demand for 7 times the original offer. And on all these cases here, you'll see on average the non-catastrophic settled for about 10 times the original offer, on average 6 months post demand. Now, on the 3 catastrophic cases mentioned below at the bottom, the attorneys probably would have gotten the life care plans regardless, but they would have had to have paid for them out of pocket. Again, by using the plans earlier in the litigation, you can push the adjusters to raise reserves and settle the cases sooner. Now, the lien underwriting and funding process is pretty simple. There's an application you fill in telling us about the case so our underwriters can determine if it has legs, the case. The case viability is verified with a contract 1 to 3 days later. Then the life care planning team requests all records, an interview with the client, and discussion with the treating physician. The life care plan is prepared by the testifying life care planning expert who's promptly paid by us. The expert in no way works on contingency and is generally produced the life care plan 4 to 8 weeks after the process starts, sooner if necessary. Should testimony be necessary, the attorney pays the expert their customary testifying fee, and the expert, of course, visits the plaintiff pre-testimony. Typically, the testifying fees are $4,000 to $5,000. Upon settlement, the funder is paid $8,500 for non-catastrophic cases, or double that, $17,000 on catastrophic cases, making the funding risk-free. If you lose the case, you owe nothing. Here's a simple part of the application process. You tell us about the case, the type of case, etc. We also provide vocational and economist reports on a lien. The vocational provide the impact on job placement and range of job alternatives, handicaps, etc. The economist provides for present value calculations for past lost earnings and benefits, future earning capacity, household services, etc. And the economic report typically supports the life care plan and vocational assessment reports through economic and financial modeling. The report fee is $47.50 each. I mentioned earlier our medical cost projections. These are akin to baby life care plans. They're for your $50,000 to $200,000 value cases that are likely to settle. These aren't really intended for trial. They're a little less detailed than your typical life care plans, but they give you what you need. The medicals are reviewed, determining future care, anticipated outcomes with associated expenses. The records include, and the analysis includes surgeries, office visits, therapy tests, equipment, and med needs. It's produced by a testifying life care planner. On this, there's a $2,000 upfront fee. If you absolutely need an MD life care planner, there's an additional charge of $500, with normal turnaround being 3 to 4 weeks. And there's a surcharge if you need it sooner. Here's a sample of a medical cost projection. You can see there's chiropractic care, orthopedic evaluation, PT, actual surgery, with the total costs adding up to $194,000. This is a fairly common projection, and it can help get you much closer to the policy than just, talking vaguely of future medical needs. Here, there's a simple order form for this. And in conclusion, with medical cost projections and the LCPs, attorneys need no longer to leave money on the table for deserving cases valued at $50,000 and up. For the first time, you can utilize these services practically cash and risk-free to both deserving catastrophic and non-catastrophic cases, maximizing the settlements and firm profit. I'm going to be asking Linda a few questions before taking your own, which again you can type into the box on the right side of your screen. Afterwards, we'll send everyone both a 2-minute animated overview of the service, as well as the webinar that you can share with colleagues. Now, my first question to Linda, Linda, does the life care planner communicate with the attorneys?
Absolutely. Hi, everyone. Yes, we do. We contact the attorneys to collect the medical records that we need. If during the process we discover there's something missing, we'll go back to make sure that we have everything that we need to prepare a reliable, credible report. That's the goal.
Now, Linda, what can you do if the plaintiff's treaters are uncooperative and won't provide input into the future care needs? What should the attorney do to overcome that?
Well, sometimes, we try our best to get the treating doctors. They're the ones that know the patient, know their risks and their comorbidities, and they have a treatment plan in mind for them. If they won't cooperate with our request for information, sometimes I'll have the client, the patient themselves, ask the doctor, please, can you help me? I need this. So if we absolutely cannot get the treating doctor to cooperate, the next best thing would be an IME physician or someone who's actually examined this patient and knows what their treatment needs would be. In the absence of that, then we'd have to go to clinical practice guidelines and get the expected treatment from that.
Okay. There's an ongoing debate whether attorneys should use MD life care planners or non-MD life care planners. Now, 99% of life care planners are not MDs, but that's changing. One problem I've noticed with MD life care planners, and there are pros and cons to both, but one problem I've noticed with MDs is that at times they'll ignore the treaters who provide the necessary medical foundation upon which the plan is predicated on. Sometimes, being doctors who think they know everything, they'll sometimes substitute their own opinions and get into trouble, often having their testimony struck and or dorbered out, where you have doctors, physiatrists, for instance, commenting on future orthopedic needs and costs. So sometimes they can get themselves in trouble and go overboard. One advantage of them for sure is that if the treaters are uncooperative, perhaps a physiatrist can try treating the patient and provide the foundation themselves. That's one advantage. And clearly the MDs, their CVs, have that extra MD credential, which is a plus. Typically, though, you're paying a little more for that MD for their services. The non-MDs are taught to focus on the future pricing and the medical and non-medical needs. That's all they're supposed to be doing here, not offering their opinions, which makes them much less exposed to cross-examination on the medical issues. They usually leave that up to the treating doctors and don't have to deal with it at all. So there are pros and cons to both. Linda, if I left anything out, any other comments you have on that?
Yeah, I do, actually. A life care planner does not treat. So when you had said previously that the physicians, life care planners can start to treat the client, that's a conflict of interest. They should not be treating. They should put themselves in the place of any life care planner, objective and identifying the needs, medical and non-medical, and then put together the plan according to the standard published methodology.
All right, Linda, you've prepared quite a few life care plans and also medical cost reports. What feedback have you gotten from clients as to their impact on the settlements, particularly with the medical cost projections?
Oh, so far very positive. We've had several come back to us and tell us that there was a pretty significant increase in settlement with the use of the cost projection. One in particular, where an attorney received a close $100,000 settlement on a case that was offered almost nothing, and the client only had one injection. So that was a pretty significant outcome with using this process.
Right. I think that was a case out of California, out of LA. Now, I'm going to take a few questions that have come in. First question is, how is the geography of the testifying life care planner when you need them for trial? Well, we have life care planners in various parts of the country, and we're adding to our network all the time to try to get them as close to the case as possible. But if the life care planner is not living within an easy drive of the of the courthouse or where the plaintiff is, then it almost within reason doesn't matter where they are, because they're likely to have to fly in to see them certainly before they testify. That's a given. We can often give several different choices to clients as to where the life care planner is located. We're happy to share that even before the case is submitted. Another question is, what happens if you need to change a baby life care plan into a full one or go to trial? And if need be, we'll simply have the initial life care planner expand upon that plan. There'll be an additional fee owing that you'll know in advance because more work's going to be involved. And that happens rarely, though. We find a very small percentage of these cases wind up going to trial. These $50 to $100, $200,000 cases where there's good liability, they invariably get settled. The last question I see: do you have a life care planner in California? Yes, and another one in nearby Phoenix. Are there any other questions? Well, if not, I'd like to thank you all for your time, and we'll be sending you a copy of this webinar for your use and for colleagues. Thanks again for your time.